News Special Report.
And good afternoon. I'm Whit Johnson in New York. We are coming on the air once again because the White House is about to hold a briefing with an update on President Biden's condition following his COVID diagnosis. The president's physician, Dr. Kevin O'Connor, releasing a letter this morning saying that Biden's symptoms have improved, though he did mount a temperature last evening of 99.4 degrees. That's just short of a fever. We're told he responded well to Tylenol. Dr. O'Connor also saying that the president is now taking a low dose of aspirin because the blood thinner he regularly takes has been suspended while he's on the antiviral drug Paxlovid. Now, just moments ago, the president was seen attending a virtual meeting with his economic and energy advisors on lowering gas prices. Take a look.
The floor over to you, sir.
Well, thanks. Let me start by apologizing for my voice. I'm feeling much better than I sound. You know, we're meeting today on gas prices, and we have some really good news.
You heard the president there saying, I'm feeling much better than I sound. Earlier, the White House also tweeted this photo of the president at his desk in the residence today, saying he is continuing to work, including speaking by phone with his national security team. So you're also looking at a live picture right now. This is the White House briefing room. We are awaiting any moment to get an update on the president's condition. We've also learned that the First Lady, Dr. Jill Biden, tested negative in Wilmington, Delaware this morning and remains symptom-free. Now, officials working with the First Lady tell us that she is going to stay in Delaware while the president is in isolation at the White House. It's also worth noting here, it was just a few months ago that Vice President Kamala Harris also tested positive for COVID. This was late April. She had returned from a trip to Los Angeles, tweeted out that she was feeling fine, didn't have any symptoms. Both the president and the vice president are fully vaccinated and double boosted. The White House press secretary, Karine Jean-Pierre, is expected to join Dr. Ashish Jha, the White House COVID response coordinator, again, with an update on the president's condition. So here they come right now. Let's go ahead and listen in.
Good afternoon, everybody. So first, I wanted to read you the letter from the president's physician updating you on the president's health. President Biden completed his first full day of Paxlovid last night. His symptoms have improved. He did mount a temperature yesterday evening to 99.4 degrees Fahrenheit, which responded favorably to Tylenol. His temperature has remained normal since then. His symptoms remain characterized as runny nose and fatigue, with an occasional non-productive, now loose cough. His voice is deeper this morning. His pulse, blood pressure, respiratory rate, and oxygen saturation remain entirely normal on room air. The president is tolerating treatment well. We will continue Paxlovid as planned. His symptoms will be treated supportively with oral hydration, Tylenol, and albuterol inhaler that he uses as needed. His Eliquis and Crestor are being held during Paxlovid treatment and for several days after his last dose. During this time, it is reasonable to add low-dose aspirin as an alternative type of blood thinner. As I stated previously, the president is fully vaccinated and twice boosted, so I anticipate that he will respond favorably as most maximally protected patients do. There has been nothing in the course of his illness thus far which gives me cause to alter the initial expectation. Early use of Paxlovid provides additional protection against severe disease. He will isolate in accordance with CDC recommendations, and he will continue to monitor him closely during this very common outpatient treatment regimen. As promised, I will keep your office updated with any changes in his condition or treatment plan, respectively, Kevin C. O'Connor. So I also wanted to update you on what the president has been up to and how he's continuing to work hard on behalf of the American people. Last night, the president signed the baby formula bill Congress passed. He also spoke with Senator Carper to see how he was feeling and to the hosts of yesterday's DNC event to thank them for their flexibility. This morning, the president received the president's daily briefing virtually, as you all know. He also met virtually with his economic team on the progress being made to lower gas prices for American families, as you all saw yourselves. Dr. Jha and I spoke to the president over FaceTime this afternoon. I asked him if he had a message for the American people. The president said he's still putting in 8+ hours of work a day, and that he wants to remind Americans to get vaccinated because, in his own words, it matters. Look, the president hopes the country will see that while we should continue to take COVID very seriously, we have the tools we need to deal with this. President Biden is benefiting from 2 vaccines, 2 boosters, and he's advocating for every American to take advantage of these vaccines and boosters, which we have made available for free at 90,000 convenient places nationwide. And he's benefiting from Paxlovid, a powerful antiviral we've made available at 42,000 locations, including local pharmacies across the country. All Americans have access to the same vaccines, boosters, treatment that President Biden is receiving right here at the White House. And the president hopes that all Americans who are over 50 get boosted now if they haven't already, and get Paxlovid if they test positive. Now I'm glad to return to the briefing room Dr. Jha, the White House Coronavirus Response Coordinator, who is joining me today, and we're happy to take some questions. Go ahead, Dr. Jha. I know you have a few things that you wanted to share.
Right. Good afternoon, everybody. I'm going to make a few remarks, some things similar to Corinne. First of all, good to be with all of you today. You just heard Corinne give an update on the president, and I'm happy to answer questions about his health in a second. As you heard, we FaceTimed with the president earlier today. I also spoke at length multiple times today with Dr. O'Connor. And as you all saw just a few minutes ago, the president is doing better. He slept well last night. He ate his breakfast and lunch. He actually showed me his plate. Didn't ask about the menu, but I did see an empty plate with crumbs, and I have some guesses about what was there, but didn't ask.
No comfort food?
Didn't ask. I did ask him about his appetite. He joked that his one regret was that his appetite had not changed. Look, he is in a very good mood. I want to take a step back and emphasize the message that you heard from Corinne. As the White House COVID-19 response coordinator, what I think every American needs to hear, what the president laid out, is that while we have a very contagious variant out there, thanks to this president's leadership, we have the ability to manage this. We are now at a point, I believe, where we can prevent nearly every COVID death in America. That is a remarkable fact. So if you are vaccinated but have not gotten a booster, this is a really good time to go and get a booster. If you're over 50 and haven't gotten a vaccine shot in the year 2022, this is a really good time to go and get a shot. They are free, they are widely available, and as you heard, if you are over the age of 50 or have any kind of chronic condition that meets CDC criteria, please consider getting treated if you have a breakthrough infection. And if you don't have a regular doctor, you can go to covet.gov and find a test to treat site near you. I also want to share some data about the progress we are making both on vaccines and treatments just over the last couple of weeks. Over the last 7 days, we've gotten 2.2 million more shots into people's arms. That's the highest we've seen in a month. More than 900,000 Americans have gotten their second booster shot in the last week. That's the highest number in 6 weeks. So as Americans go about their daily lives this summer, they're heeding the public health message. And not just on vaccinations, by the way, on treatments as well. You know, when I started in this role about 3.5 months ago, we were seeing less than 4,000 prescriptions a day of Paxlovid. Now Paxlovid prescriptions are at their highest level. Last week, about 40,000 courses of Paxlovid were prescribed every single day across America. It's a remarkable fact. And if you think about the fact that we have about 120,000 identified infections, even if you assume that some infections are not getting identified because of home tests, it's a large proportion of people getting Paxlovid. I think that's really good. It's preventing hospitalizations. It's preventing deaths every day. Overall, just so far in the month of July, 920,000 Americans have benefited from Paxlovid. We have secured 20 million courses of Paxlovid. That's the most in the world by a lot. And again, we've made it widely available and, of course, free. All right, let me finish by providing what I think is really the bottom line. It's great to see the president doing better. He's doing better because he is vaccinated, he is boosted, he's getting treatments. He is getting world-class treatment, exactly what you would expect for the president of the United States. And the president has made clear to us that it's incredibly important to him, and therefore it's incredibly important to all of us, that all Americans have easy, free access to the same world-class treatment that he's getting. Vaccinations, therapeutics. So my message to my fellow Americans really is this: please avail yourselves of this vaccine to build up your immunity. Please avail yourselves of treatments if you qualify, if you get infected. And let's continue to do everything we can to prevent serious illness and death from this pandemic. All right, thank you very much for listening, and I'm happy to take questions, as I know KJP is as well.
A few quick ones. I know the White House released his elevated temperature level of 99.4 degrees. Can the White House provide specific numbers on his oxygen levels, blood pressure levels, beyond just saying that they are normal? Would you be willing to release that information?
You know, what I will say is he gets his vital signs checked several times a day. So, of course, there are multiple numbers in there. All of his vitals, including his temperature, I would argue, but all of his vitals have always been in the normal range. His heart rate, his blood pressure, his oxygen level, and his temperature. The 99.4 was the highest temperature he's had in the last, well, 24 hours, but I would say since his diagnosis. But he's had normal vital signs throughout the entire course of the disease.
And by this point, has the White House identified all close contacts of the president? And do they go beyond, I believe, the First Lady, the Vice President, and Ron Klain?
So the White House Medical Unit has identified and informed 17 people determined to be close contacts of the president, including members of his senior staff. None of the staff members have tested positive to date, and all of them are wearing masks around other people per CDC guidelines. No members of the press have been identified as close contact as well, and this also includes the member of Congress that he traveled with recently.
And I just want to triple clarify the testing dates, because if yesterday was day 0, today's obviously day 1, Tuesday would be day 5. So does that mean he won't be tested until day 6? And if he's negative on Wednesday, then he could resume in-person activities? Is that the timeline we should be understanding?
Yeah, so we're going to, obviously the CDC guidelines, right, are 5 days of isolation. He will do that, those 5 days of isolation. He will be tested after he's completed his 5 days of isolation. And once he tests negative, he will return to work.
So he'd be first tested next on Wednesday.
Yeah, I haven't done the math, but yes, he's going to do 5 full days of isolation. Today's day 1, yesterday was day 0. And he'll get tested after day 5. And then, again, the moment that he turns negative, he'll return to work.
And you guys both talked a lot about, obviously, the message from the president being get vaccinated at this time, but you also mentioned just how extremely contagious this variant is. So why not do additional mitigation, encouraging additional mitigation measures like mask wearing indoors or other methods?
You mean in general?
Yeah.
Yeah, absolutely. And I did a COVID briefing, I don't know, about a week ago, in which we laid out our 2-pronged strategy. I actually think I did it yesterday, where I said 2-pronged strategy, 1 to prevent serious illness, 1 to prevent infections. So in terms of mitigation, very, very clear. CDC guidelines on this very clear. If you're in one of the orange zones, people indoor spaces should be wearing a mask. It's a great way to prevent getting infected. It's a great way of preventing spread. Another important mitigation measure is using regular testing. The president obviously gets tested regularly. Many of us get tested regularly. We've sent out 560 million tests, I believe, if that number is right. I think it's 560 million tests to Americans directly for free from covittest.gov. People can go and get tests. Tests have become cheaper. You can get it through your health insurance. We think regular testing is another important mitigation measure. And then we're doing a whole series of work on trying to improve indoor air quality, improving ventilation, filtration. So we are doing a lot on mitigation. And we talk about it. I'm talking about it now. But, you know, when we're talking about the president, who is now infected, the key is to also remind people that we have a very contagious variant. People will get infected. Our absolute priority is making sure that when people get infected, they don't get seriously ill.
Thanks. Dr. Jha, how frequently is the president being examined by a physician in person?
Well, so the president's people are interacting with the president all day through Zoom and stuff. Dr. O'Connor has been seeing him on a regular basis. I think, I don't have an exact number of times that he saw him yesterday or today, but multiple times a day, either by phone call, by Zoom, physically examining him. But the president's doing really well, so he doesn't need an ongoing, exam all the time. And obviously he's getting examined at least once a day. But Dr. O'Connor is interacting with the president on a regular basis.
And has the president been examined?
You're listening to Dr. Ashish Jha, the White House COVID response coordinator, giving an update on President Biden's condition following his COVID diagnosis. He essentially said kind of what we heard earlier from the president's personal physician, that President Biden is experiencing mild symptoms but is doing better today. Dr. Jha said that he FaceTimed with the president earlier today. The president is doing better. He ate his breakfast, ate his lunch, and actually made a joke that his one regret is that his appetite hasn't changed. Overall, they say that all of his vitals are in normal range. We did, with this letter from the president's physician, learned that he had an elevated temperature yesterday of 99.4 degrees. That's just shy of a fever. They didn't give any specifics on his blood oxygen levels, but just said that all the vitals have been in normal range throughout the entire course of the disease. We also learned a little bit more about the White House contact tracing efforts. Of course, the president was out and about. He was in Massachusetts earlier this week speaking about climate change. The White House says they have identified 17 people who would be determined to be close contacts of the president. None of them have since tested positive for COVID, and no members of the press were included in that number. Let's go ahead and bring in ABC's chief medical editor, Dr. Jennifer Ashton, who's been following along with this. Dr. Ashton, always great to see you and get your input on this. This letter from the president's physician, we talked about the elevated temperature. There were also some other things in there about the medications, the Paxlovid that he's taking, and also the use of an inhaler. Is there anything in this letter that gives you cause for concern?
There really isn't, Whit. Let's go down the line in terms of what we've heard so far. And again, it would be nice to hear directly from Dr. O'Connor, as we have in the past when other presidents have been ill. Certainly when they're hospitalized, we would expect that. But a lot of clinical questions about the president that Dr. O'Connor would be great to answer. But he mentioned the maximum temperature overnight was 99.4. We do not consider that a fever in medicine until it goes above 100.4 degrees. Vital signs being normal, of course, is reassuring. And the actual number really doesn't matter. As long as they're within that normal range, people's vital signs do tend to fluctuate. Yours do, mine do. Anyone with COVID can have a fluctuation as long as it stays within that normal range. We've heard that certain medications that the president takes routinely have been held because he's taking Paxlovid. That is standard. There is a long list of potential drug-drug interactions, even interactions with supplements like St. John's wort. So that's pretty standard. And then you mentioned the inhaler. That would be either a steroid inhaler or something like an albuterol inhaler that can be given to someone with bronchitis. It could be given to someone with asthma, overall reactive airway disease, someone who's been coughing a lot just for symptomatic relief. It's unclear how long the president has been on that. And again, I want to really emphasize here, Whit, there is so much speculation and trying to read between the lines here. The only people who really know what's truly going on are the president's physician and the president, that doctor-patient relationship. And of course, there's interest on the part of the American public for news about the president's condition. But I've been very reassured by what we just heard in this press conference.
And I want to pick up on that thought in just a moment, but just wanted to make a few other points, because one thing that we've been hearing repeatedly from the White House, they keep driving this point home, is the fact that the president is double vaccinated, and double boosted, and is taking Paxlovid, this antiviral treatment, and making the point that these are free treatments and vaccines that are available to everyone, that the president is not getting special treatment that you or I wouldn't be able to get. So the White House has been driving home that point. But back to your initial question about why Dr. O'Connor has not been talking to the press or talking to the public directly. We did see when former President Trump got COVID years ago, that his doctor came out. That caused some issues about the timing of different things. What specifically would you want to hear from the president's personal physician?
You know, Whit, I don't think that anything that's been released raises any question marks for me as a physician. I think that there is general curiosity on the part of the media and the public, but I think that, a lot of times this is really a question of optics, right? When you don't hear from the doctor directly, it's very common to think, what's being kept from me? So, when I take care of a patient, I communicate directly with that patient's family, not through a messenger. But obviously, the White House has its protocols, and that's our job here, is to try to interpret the information as we get it.
And as you pointed out, he is the president of the United States, and he is at an age that is elevated risk. And so the American people are interested to know those details between the lines. Dr. Ashton, always a pleasure. Thank you so much. We appreciate it. Our coverage here continues on ABC News Live and abcnews.com. You can get breaking alerts on the ABC News app. And we'll be right back here with the entire team for a full wrap-up on World News Tonight. I'm Wade Johnson in New York. Have a great day.
This has been a special report from ABC News.
Hey everyone, I'm Terry Moran. You're watching ABC News' continuing coverage of President Biden's COVID-19 diagnosis. White House Press Secretary Karine Jean-Pierre and White House COVID-19 response coordinator Dr. Ashish Jha are still giving an update from the White House briefing room. Let's take you back there now.
Inform Americans that the best way to reduce that number, the best way to make sure that fewer people die, fewer people get hospitalized, is to make sure people have built up their immunity through vaccines and that people get treated when they have breakthrough infections.
First for you, Dr. Jha, and then I have one for you too, Karine. So on bringing him down from the Eliquis, a number of physicians have suggested that having the dosage might also be, or might be a preferable option. Could you talk a little bit about why that course wasn't taken?
Yeah, there are several different ways of doing this. What I know is that I spoke to Dr. O'Connor. He has consulted, and again, we had a plan that, and Dr. O'Connor had a plan to consult experts at Walter Reed, at GW, elsewhere. He's done those consultations, and based on that input, Dr. O'Connor made the decision to stop it for 5+ days and then start aspirin.
And just to clarify, and he has started the aspirin course, or that was just something that was recommended?
He has started the aspirin course, as I understand it.
For you, Karine, I didn't hear in your introductory remarks a look ahead to next week, and I'm just curious if you have anything, if this is going to delay the Xi meeting, for example. Where are we on that?
So as far as President Xi, I don't have anything to share on that. I know the president spoke to that a couple days ago, and his words was he's expected to speak to him in the next 10 days. Nothing on his schedule to share at this time. Look, when it comes to President Xi, we have kept open communications with China, as we have stated many times before, on staff level. The president last spoke to him in March. I don't have anything more to add on that. When it comes to the schedule, we'll see how the president does. He's improving, which we all should be thrilled that the President of the United States is doing better, according to Dr. O'Connor. That is good news, and we welcome that good news, and we continue to wish him well.
Karine, are the chances of serious complications behind the president now? Can you all at least speak to that?
Yeah, what I would say is he's continuing to be monitored very, very closely. It's obviously this is day one, but it's his second day that since his infection was identified. I'm really happy to see that he is getting better, and we will continue monitoring him very closely until he tests negative. And so,
chances of serious complications?
I think the chances of serious complications for this president have been dramatically reduced by building up of his immunity and getting him antiviral drugs, the things that really make a huge difference in lowering his risk. And that's, I think, the most important part of this. We'll continue monitoring him. And we'll see how he does over the next few days.
Thank you.
And I just wanted to add, as far as schedule and events, look, the president was very active today. He had said he's working 8+ hours a day, and that is, he's still doing the job of the president, so that does not end. And we have put out photos and videos. You guys heard from him directly, so I just wanted to add that as you're asking about, his schedule. Okay.
Just a quick follow-up to Mary's question about the inhaler. Has the president used an inhaler since testing positive for COVID, or was Dr. O'Connor just saying if he needs it, he will use it going forward?
Yeah. What I understand is that he has used it a couple of times in the last since testing positive. He's got, as you may have heard, he's got a cough, and I mentioned this yesterday. It's in the Dr. O'Connor's note. Oftentimes, when people get viral syndromes and they get a cough, taking an inhaler can be helpful. So he's taking that.
The use of the inhaler was not noted in his last physical, right?
It's not a regular medicine that he uses, right? He really only uses it intermittently, largely when he gets viral syndromes, when he gets colds, basically. And so it's not a regular medicine that he uses on an ongoing basis.
The other question I have for you, Dr. Jha, Vice President Harris is a close contact of the president's, and the CDC guidance says that if you're a close contact, you want to wear a well-fitting mask when you're around other people. She just spoke at a conference in D.C. and she hugged someone without a mask on. She was also maskless for most of that conversation. Would you have recommended that she keep her mask on, given that that is the CDC guidance?
I think I'm not sure what I have not been tracking the vice president's activities, so I don't have anything specific to say about what she did. My understanding is that the vice president is following CDC guidelines on close contact. She's also recently been infected, so within the 90 days of a previous infection. But I don't know if you have anything else to offer on the vice president.
I guess she isn't following the CDC guidance, though, right? If she is hugging someone without a mask on. Just wanted your clarification on that.
Yeah, I think the CDC guidance is clear, but the problem is me commenting on what the vice president did when I haven't seen it or I don't actually know what happened is very, very difficult. So I'm going to pass.
She took off the mask and she embraced someone. You don't have to see it. I mean, that's what happened.
Yeah. So usually when we think about people having contact, it's for an extended period of time. I don't know. Again, I didn't see the hug. I don't know how long the hug lasted, but it's very hard for me to comment on something I really didn't see. So.
And Karine, the president had said that he was going to receive a report on monkeypox today. Is that happening? What is the report? Do you know?
Yeah, I don't know where that report is. I know there is a report that has been written for the president. Whether the president has had a chance to see it yet today, I don't know.
So it's an internal report that he will be receiving from his advisors.
Yes.
Will that be made public or?
I don't know which. I mean, the president gets lots of reports from his advisors. I don't know which ones get made public. It's just an update on the status of monkeypox.
Yeah, I would just look at that as an update to the president on what we have been doing in responding to the monkeypox. It's not a report to share out. It's something for the president, which he gets very often, just to get a sense of the work that we're doing on an issue. That's what. Go ahead.
Just for clarify a couple details for accuracy in reporting, you said of the 17 close contacts, one of them is a member of Congress. Is that?
No, I was saying it includes the members of Congress. I do not have the specific of each person.
Is that something you would be able to detail without identifying them?
Well, we just want to be, privacy is incredibly important here. I would reach out to them directly. What I'm saying is we've contacted 17 people. Within those 17 people, there's senior staff. Within those 17 people, it also includes members of Congress. And as to date, no one has, as far as we know, no one has tested positive.
And then I guess not specific to those close contacts, but can you tell us, is there anybody else on the White House campus right now who has tested positive this week?
Out of abundance of privacy, to protect people's privacy, our protocol is to only share if someone has had close contact to the president and the four principals. That is just our protocol. We have to keep people's privacy here, and that is incredibly important, and we respect that.
Understood. So just for clarity, even if without identifying names, we can't do it.
Again,
totally.
I'm not going to share private information or private detail on anybody. anybody.
I want to get your reaction to Steve Bannon, but while we're on this topic, can I ask you, Dr. Jha, very quickly? We don't know what this is, but there could be earlier indications of what type of subvariant it is. You said it could happen within less than a week. Just for the sake, and I know it's a bit of a hypothetical, but over the weekend we may learn some more details, may not see you. BA.5, which is the most dominant subvariant right now, is that one that after you get that, you could be more inclined to get another one within a smaller period of time? In other words, someone who got something recently, is that one they're more eligible or more able to get? Can you help people better understand who are concerned about it?
Yeah, absolutely. So BA.5 is the most immune evasive variant we've seen. And what that means is that if you were infected 3 months ago, 4 months ago, your protection against getting reinfected with BA.5 is much lower. If you were vaccinated 5-6 months ago, you have a much higher risk of getting a breakthrough infection. If you're infected with BA.5, what that means for future immunity, none of us know right now because it's BA.5. It's just become dominant. It's the primary. So we don't know what the implications are. And we obviously don't know what variant or subvariant the president was infected.
I guess I should ask, how about if you just had it a month ago? 3 months ago, I recognize it's lower, but for someone who had it a month ago, if it's immune invasive, does that mean you could get it within a month of having had another case?
So depends on what you had a month ago, right? And if BA.5 wasn't dominant then, but it was still present. Obviously, if you had BA.5 a month ago, then you're much less likely to be able to get BA.5 now. So it just depends. We have seen occasionally people getting infected within that 90 days, but it is still relatively uncommon.
Thanks. Did you have any reaction to the Steve Bannon case? I know it's over, and I know obviously.
What did you just say? Which was the last part? I missed the joke.
All right, there's White House Press Secretary Karine Jean-Pierre and the White House COVID coordinator, Dr. Ashish Jha, briefing reporters in the country on the president's status after having been diagnosed with COVID-19 yesterday, how he's doing. You heard he's doing well, responding to his treatment. He's got Paxlovid, Tylenol, spiked a little tiny bit of a temperature, not even qualifying as a fever. The White House put out a video. The president's voice sounds a little hoarser, and he said he feels better than he sounds. So for more on all this, let's bring in physician at Stanford's Children's Hospital and ABC News medical contributor Dr. Ella Patel and ABC News senior national policy reporter Ann Flaherty. So Dr. Patel, the White House COVID response coordinator, Dr. Jha there. He says the U.S. is now at a point where we can prevent nearly every COVID-related death. He's essentially saying that look at how well the president is responding to all the vaccinations he's had and to the treatments that he's getting. But only 67.2% of Americans are fully vaccinated right now. Do you think what Dr. Jha says is wishful thinking, or do you think that's really within our grasp at this point if we can get people vaccinated?
Terry, I think to some degree it is wishful optimistic thinking, but it's not completely baseless because if you actually look at the science and you look at President Biden's situation as a model, if we were to get everyone who is out there who's eligible for a vaccine and their second booster, all their shots, if we were to get people a booster, people in high community transmission areas took those precautions, surely we would cut down on the roughly 500 to 600 deaths we're seeing per day. But it's a little bit more complicated. And when we look at the fact that according to the CDC, we have about 30 million uninsured Americans. There are people out there who do not have the access to get out there and get these treatments. There's people out there who I hear from who can't get Paxlovid. So there are some barriers to care that we need to address, not only right now, but in the future as well. But yes, in a perfect scenario, we would want to see a much higher rate of vaccines and boosters out there to prevent those unnecessary deaths. The fact that we are among the lowest of developed countries for older adults getting their second booster, that is just a metric that we need to fix.
It's a great reminder, doctor, that public health is not just the treatments and the vaccines and the miracles of modern science. It's access, it's politics. And the White House answered more questions from the press today about the protocols and what's been happening at the White House. Well, what have we learned about how the White House is handling this predictable but still very serious situation where the President of the United States has come down with COVID?
So we heard just now that there are 17 people who've been determined to be contacts of the president, close contacts. This means that they should, if they are vaccinated, they should be wearing a tight-fitting, high-quality mask in public. We are told that these are senior staff members and members of Congress. They will not give us more details than that. 17 people, that's a somewhat large number. The president is known for his public events, handshaking, hugs, and that sort of thing, so it's not surprising. But all of those people have tested negative so far, but I just want to point out that they would test negative. It would likely be on day 4 or 5 after their exposure to the president that they would then test positive. So we still don't have a lot of details on that. But that, I think, was the most telling detail from this press briefing.
And the White House being pretty transparent about the contacts, about the president's health, which right now, thank God, he's doing well on all of this, and we count on that going forward. And Dr. Patel, thank you as always for being with us on these subjects. And we will have continuing updates right here on ABC News Live throughout the day, and a complete wrap-up tonight at 7 p.m. Eastern on ABC News Live Prime with Lindsay Davis. Thanks for joining us. I'm Terry Moran. We take you back now to GMA 3.
As a professional athlete, you want to do stuff that's awe-inspiring, death-defying.
I continue to chase that feeling, but there's an absolute moment of leap of faith.
To be an elite adventure athlete, you have to push past the fear to achieve a transcendent experience. Sometimes the only way to find the edge is to go over it.
We were creating the perfect Mormon family. And then I fell in love with my friend. Yeah, I'm like stupidly in love with her. Leaving the church was leaving who I was. The lesbian ex-Mormon story is not something that's been shared very much, but I feel like our story needs to be told. Nobody tells you when you're Mormon is that there actually is another way.
This is ABC News Live.
The crush of families here in Poland.
At refugee centers.
In Putin's Russia.
On the ground in Ukraine.
Close to the front line.
Here at the White House.
Destructive Cat 4 storm.
Here along I-5.
Boston is in the bullseye.
Let's go. We made it.
ABC News Live, America's #1 streaming news. Anytime, anywhere. Streaming 24/7 straight to you for free.
Thank you for making ABC News Live America's #1 streaming news.
Take America's #1 news with you anywhere you go, anytime, free. Download the ABC News app now. Breaking news, exclusives, 24/7. There for you with one touch. The ABC News app. Download it now.
Tonight, President Biden isolates with COVID as the virus surges. Plus, what the former president was doing as the violence unfolded. What happens next? More Americans turn to World News Tonight with David Muir, the most watched program on all of television.
Welcome back to GMA3, everybody. Right now, we're going to meet a Latina therapist who is working to increase mental health equity in the Latino community with her podcast, Latinx Therapy.
It's really important for Latinos, Latinx, and Hispanic folks to learn about mental health. I'm a licensed marriage and family therapist in the state of California and the founder of Latinx Therapy.
I wanted someone to say, it's okay if you're not okay.
Because we all deserve a place where we can show up at our fullest. Latinx Therapy was established in 2018. I was so passionate to start the Latinx Therapy podcast. It is something that is so inclusive and gives voice to a lot of different people. We talk about a wide range of topics in English and in Spanish. And some of these topics include intimacy, destigmatizing diagnoses such as bipolar disorder, narcissism, codependency. We talk about sexual abuse and how to cope, intergenerational trauma. My podcast was one of the first created by a master's level trauma-informed therapist, myself, daughter of immigrants, and a teen mom. I come from a Mexican father and a Guatemalan mother. I just remember my childhood, there was just no time really to talk about mental health. One of the misconceptions around how some Latinos should heal actually involves